Welcome to Advanced Home Care's Oasis Video Tip of the Month for May 2012. Our focus this month is on assessing patients' ADL status and the collaborative Take 5 approach. Just a refresher from the April Oasis Tip of the Month. ADL stands for Activities of Daily Living and refers to basic self-care activities like dressing, grooming, and bathing. IADL stands for Instrumental Activities of Daily Living and refers to activities that support ADLs and independent living, such as the use of the phone and meal preparation. Our Take 5 Oasis review items include ADLs, dressing, bathing, and ambulation. Now let's take a look at a patient scenario while you focus on the assessment approaches used by the clinicians and collaboration.
Okay. Hey Trish,
Hey Joy, how are you?
what you doing?
Well, I'm finishing up this Oasis.
Yeah, aren't you glad it's Friday?
Yes, thank goodness.
Me three.
What you up to?
Hey, I would looked at your Take 5, the note that you wrote on your assessment of that patient we saw today.
Now, who would that be?
That was Miss Jones.
Oh, okay.
The
I remember
little
her.
old lady, lives alone. Yeah, we're just kind of doing a basic assessment.
Oh yeah, I remember her. Yeah.
Yeah, did you? And I felt like when I watched her walk and spend some time in the bathroom, she was really unsteady. I felt like she was kind of a tree blowing in the wind and could easily go over at any moment.
Oh, really? Well, when I got there, she was fully dressed, and I did see her walk to the bathroom, and she was a little wobbly, but she seemed to be doing okay. But you feel she was really that wobbly and it's really unsafe?
Yeah, I think she could fall very quickly. I think we're going to have to really work on getting her to be compliant with that walker. And I really think probably her ambulation score should be a 3.
Really? Okay.
Even
She
though
was wobbly, but she lives alone and she does a lot by herself. So, but if you feel like that, you're the therapist.
She may do it by herself, but I don't think it's safe.
Okay. Okay. Well, I'll go back in and look at that, and then change that.
Yeah.
Because she was a little wobbly. So.
Yeah.
Both the RN and the physical therapist observed the patient perform ADLs, including a grooming task, as part of their assessment. The RN observed the patient and initially assessed her to be independent, scoring the patient as 0. On a follow-up visit during the 5-day assessment period, the physical therapist observed the patient grooming and assessed the patient to be unsafe, scoring her a 2. Through collaboration and clinical discussion, the nurse reviewed her Oasis response and, based on the input given, determined the most accurate answer reflecting the patient's unsafe approach to ADLs. Remember that the purpose of the Oasis tool is to capture the patient's most dependent functional status during the 5-day assessment window. Identifying, capturing, and documenting the most dependent functional status gives us all the most accurate depiction of the patient's overall burden of care so that the most appropriate resources and care possible are provided. Remember that the patient's Oasis must be completed by one clinician. Must be completed by one clinician refers to one person actually marking the scores on the Oasis tool. Medicare has given us scenarios that support a collaborative approach. The admitting clinician either agrees with the assessment of his or her peer through discussion of what they both saw, or that admitting clinician would need to make another visit to assess and determine the most accurate score for the patient. Of course, the admitting clinician could also decide that his or her original score was correct. We have 5 days to complete the start of care assessment in order to provide us time to gather all of the data and input related to the patient's status. The purpose of the Oasis tool is to capture the patient's true burden of care. If assessment during the 5-day period reveals the patient's status has changed, The original clinician merely updates the Moon 90 date to reflect the last date information was collected. Every home health agency is responsible for ensuring accuracy of Oasis data submitted. Collaboration and coordination between all disciplines who see the patient within the assessment time frame is an appropriate mechanism to ensure that the Oasis scores are accurate. Advanced Home Care's approach for promoting this collaboration is our Take 5 tool. Please use Take 5 appropriately to collaborate with your peers to ensure we are capturing the most accurate assessment of the patients we are caring for. Thank you for watching Advanced Home Care's Oasis Video Tip of the Month for May 2012.